Okay. Looks like most people have figured out how to mute themselves. Great. Okay. Thanks. I'm going to share my screen here, and then we'll get started. And I want to introduce Claudia for you. Claudia Ramirez has been working my back office for the last more than a year.
Hi.
And Claudia is a very close friend and wife of a very close friend who's been supporting me for over a year now. And she recently got her license and is bilingual, speaks fluent Spanish and fluent English. And Claudia, why don't you introduce yourself, tell people a little bit about yourself.
Hi, nice to meeting you all. I'm going to be helping Mike, so anything you need, you can also reach to me. In case of Mike, it's unavailable. We will post the phone numbers and everything so you can reach us. And well, nice meeting you all, and I'm here to serve. So I love working with people, and whatever you need, I'm at your disposal. Thank you.
Now, I assume you can hear. So if you can't, you should be able to go into the chat, which is now active, and be able to answer questions in the chat. Okay, now there are a ton of changes in Medicare. Like I've said in the email, there's more than I've been in this business now for 22 years, and from what I understand, it's the most change in any 1 year since Medicare Advantage and prescription drugs first went, actually the most since 2006. So that's a long time. And Medicare, as long as us Medicare recipients are voters, a voting bloc, I don't expect many changes in Medicare, but it will change in the future. And part of that is just budgets. I'm not going to get into politics. This is a non-political. I always believe in the Michael Jordan rule that if you take a side one way or the other, you lose half your audience. So this is all for information. And there are some things I can talk about today, but I can't get into specifics about plans and details of your plan. But I want to tell you what's going on. First of all, every day there's 11,000 people that are entering Medicare, that are eligible for Medicare, and a good portion of them are moving to Texas. So that over a year's time, that's a ton of new people in Medicare. At the same time, there's fewer doctors because of retirements, fewer nurses. And as a result, you have what I'd like to who remembers Dr. Evil? If you're in your 50s, you remember Dr. Evil from, or you can look him up on Google. But those of you that are Medicare age may remember Dr. No. And that was the very first James Bond film starring Ian Fleming's novels and starring the great Ursula Andress and 007 himself, the original 007. And that was Dr. No. And what's happened over the course of, we've known this is happening, but this has nothing to do specifically with your Medicare plan. But what's happened is that in order to spread out the amount of health care, and this doesn't matter what type of plan you have, there are rules in place that limit your access to be able to control your own destiny in terms of choosing your own doctors and hospitals, being able to see a doctor or a specialist. 60% of people today who are Medicare age have a Medicare Advantage plan. Those are great for some people, but you take on more risk. Medicare supplement people like myself and many of you, because I've been a big proponent, are still going to be impacted by the loss of doctors retiring or nurses. And as a result of that, we're all having to work a little harder to find doctors and hospitals that, as we get older and more decrepit, or have serious conditions, that we can access our doctors. And Dr. No has the reason I bring up Dr. No and Dr. Evil is because it's a rationing situation. The state of Texas recently passed, beginning August 1st, a bill that allows 10,000 doctors who have gone through the comparable training in other countries to work under the support and sponsorship of U.S. certified doctors. That's just in Texas. Many of them will be going to rural areas of Texas where the need is particularly great. Community hospitals that have relied on Medicare and Medicaid, it's more and more difficult to, and this is, I know I have people on this phone that are not in Texas or on this line, but it has an impact on everybody. What does this mean for you? It's really important that you find doctors and hospitals that are in your plan's network. And there are also a number of changes in Part D drug plans and Medicare Advantage prescription drug benefits. And let me riff for a second on that. For 2026, I cannot speak anything specifics about your plans until October 1st. That's the first day I can share information about 2026 plans, but I can talk about generalities today, or general changes. I mentioned the Dr. No. What that has to do is with this prior authorizations and approvals for being able to seek care. Prior authorizations is something that everybody is going to have to deal with going forward because of continued retirements and without getting replacements for those doctors. And how that impacts us will have to do with the type of plan we have and what Center for Medicare Services does to change benefits going forward. Medicare supplement plans are rarely spoken about in to people that turn 65. At 65, you may be perfectly healthy if you're fortunate to have won the genetic lottery pool. But sooner or later, as we age, we have conditions that may become serious, expensive, and life-threatening. Medicare supplement plan enables you to see any doctor or any hospital in the country that accepts original Medicare. And over 95% of all doctors and 99% of all hospitals still accept Medicare. Over time, that may change, but that's the rules now, and that hasn't changed for the last 22 years that I can speak of. Medicare supplement allows you to control your own doctors and limits your risk. Now, what is that risk? This year, the out-of-pocket maximum for the calendar year 2025 is $285. You meet that the first or second time you go to see the doctor, and that's all you spend. Now, you can enroll in one, as you know, when you first turn 65. After that, you have 3 months after that, then you have to answer health conditions, or if you have a Medicare Advantage plan, then you have to answer health questions and can be denied coverage or rated up so it becomes unaffordable if you're on a Medicare Advantage plan or have previously signed up for Medicare supplement plan. So there are options for you. Somewhere, and just so you know, I have a number of clients who are who sign up for a Medicare supplement plan. And I can tell you that inflation in the U.S. for healthcare, it's running at a 10% plus clip right now. And it's faster for individuals. So that 10% is an average, including employer plans, Obamacare plans, and Medicare plans. It has to do with healthcare inflation underlying. It has nothing to do with insurance. There is, as a result of that, you're going to see increases. I have consistently seen through this year Medicare supplement plan increases in the neighborhood of 18% to 23%, depending upon someone's age and their gender. Us guys have more medical conditions as we get older than women, who also live another 5.5 years longer than men. So as a result of that, don't be surprised if you have higher increases in your Medicare supplement plan going forward. Once you hit about age 70 or 71, that's when you tend to get more claims, but also everybody's going to see a larger increase. Now, if you are on fixed pension or Social Security, or have a budget, which most of us do have, then you have to weigh the additional medical expense risk of a Medicare Advantage plan versus your Medicare supplement plan. Typically, I never recommend, or I always advocate for a Medicare supplement plan because of the reduction in risk. Going forward, though, if a 20% increase in your Medicare supplement plan makes that plan unaffordable, please reach out to me. There are other options, but I want to make sure that you know that you're going to be dealing with 90% of Medicare Advantage plans are HMO plans, and PPO plan, Medicare Advantage PPO plans are going away. This year, all of the major insurance companies across the country have made Medicare Advantage PPO plans non-commissionable. Not that there's a lot of commission. There has been a lot of commission, but this started last year. Now United Healthcare, Aetna, Humana is announcing their Medicare Advantage commissions today, and I assume that the PPOs will no longer be commissionable. That is a sure telltale sign that a year from now, maybe 2 years from now, but in 2027, you can expect that Medicare Advantage plans PPO plans will go away. So it's kind of, and I'm totally transparent. I don't even look at how much money any particular plan makes, because I know if I support my clients and that I do the right thing, that that I've earned respect and trust for having done this and taken care of clients. I'm going to continue to do that, but I want you to know the limitations. Now, I know that many, and I'm blessed that at 71, I'm still in great health, having had a couple of health scares. So I can appreciate what many of my clients go through. But thanks to lifestyle changes, I now have a body of a 61-year-old man, which sounds pretty good when you're 71. But that doesn't mean the good Lord has other plans for me. And your situation is different. But I can appreciate and respect everybody's situation. If a Medicare Advantage plan is something that you want to consider, I want you to know what the issues are. I also am going to loop back to what I talked about the doctor no. Okay, Medicare Advantage plans control what doctors you can see. And there are a number of doctor no companies that all of the insurance companies will, with one exception in Dallas-Fort Worth, that they they have contracted with for their primary care physician. Those include Optum, which is a division of United Healthcare. It also includes WellMed, which has a joint venture with United Healthcare. It includes Aetna. Aetna acquired Oak Street Health. There's, about 5 or 6 physician groups that physicians are employees of these Dr. No groups. And I call them Dr. No group is because they make money by denying coverage, or by denying tests, or by the lowest common denominator. It may not even be a nurse practitioner. It may not be even an RN or LPN. It may be somebody that is in an administrative role that's conducting tests or through a telemedicine. So there's one exception to that, and that is in Dallas-Fort Worth, and it's only in specific counties. They're expanding gradually. It's a company by the name of Scott White Health Plan, which is a division of Baylor. That is an integrated health plan, meaning that the Medicare plans integrate tightly with the Baylor Scott White facilities. They've got, I was at their roadshow yesterday. They have about 9,000 primary care physicians, whereas, let's see, WellMed, I counted up WellMeds yesterday in Dallas-Fort Worth. There are about 50 primary care physicians and LPNs. So, they have, you just the law of numbers, you have more of an ability to see doctors and PAs at a Baylor facility with Scott White Health Plan than with some of the others. They will probably at some point become Dr. No's, but that's not the case. I want you to just have that. Now, Scott White is available in Central Texas. They're in far West Texas and Lubbock, and they're also available here in most counties in Dallas-Fort Worth for Medicare. If they're not, then I can still recommend other options. If you're interested in Medicare Advantage plan, then I would also suggest you consider, to reduce the risk, I recommend you consider what's referred to as the hospital indemnity plan that provides fixed benefit in the event of a hospitalization, which is where the big money is that you're liable to spend, because that's an annual, you develop something chronic, you're going to be spending that money every year if you or your partner or your spouse develop a chronic and expensive condition. So that's one option, though, if the cost of a Medicare supplement becomes unaffordable. It's not for everybody, but I'll explain it to you. I also want to know what I'm doing in terms of support. And I've always been a firm believer in not running away from problems. You may have heard me say, there are people that run from the fire. There are people that when their house is on fire, they yell out, "Help, help, my house is on fire." And then there's people that run to the fire and aren't afraid of change and will do what they can. And I've always prided myself in doing that. So, the point is, change is good. It may not be good for one of us, but it may not be good for you or for me, but change is inevitable. So I'm having these webinars to keep you posted, and also to realize I am one person. Soon, Claudia is helping me, and she is an agent, and she is really smart, and very, she's got the right spirit, and she's going to do well in this business. And that's a real commitment to make sure that Claudia is successful in this. I've also hired a receptionist who we hired today, and Claudia and I will be onboarding her beginning next week. So by next week's webinar, there will be a support person that will be able to answer the phones. And why are we doing this? Well, with over 1,000 clients, and many of them on, needing to now really seriously look at the plans that they're on and their medications. I haven't even talked about prescription drug benefits. It's really important for all clients and your friends and your relatives and your neighbors to really check this stuff out. If they just assume that their plan from this year is going to carry over from next year, they're going to possibly be quite possibly be upset at what extra they have to spend on prescriptions or the inability to see particular doctors. So this is here. I'm going out of my way to and have invested in a brand new website that is in the process of going live. You can go to new.TheMedicalInsuranceExchange.com, and that will become the primary website sometime over this weekend. It's new.TheMedicalInsuranceExchange.com, and it will be kind of self-serve, if you will. And it will be not self-serve. We're still going to be here, but what I'm asking you to do is there is it's called a survey form for Medicare. And Clau is going to put it in the chat here. You can click on the link and it's going to be in the replay. And I'm asking you to enter if you want information on Medicare Advantage plans, you'll have to enter the first and last name of your doctors and the type of doctor that it is. But most importantly, the prescription information, because there are tons of changes in prescription formularies on both Medicare Advantage plans and Part D standalone prescription drug plans that go with Medicare supplement plans. So this is one in past years, it's hard to keep up with them, but everybody needs to do this year. By asking you to complete this survey, here's what happens. I can't do anything, or you won't hear from Clout and I until after October 1st. That's the first day that we're allowed to talk about Medicare plans for 2026. Between October 1st and the first day of open enrollment, when you can enroll in a new plan, we'll be working behind the scenes to develop, as you have received in the past or initially, prescription drug recommendations and comparisons, rather, and recommendations. And it will be for the medications that are in plan formularies. I'll explain that in a second. Now, for people that are on Medicare Advantage plans, you have a prescription drug benefit, you need to do the same thing. If you complete this, if you click on this link now, you'll be able to complete that, and we'll have instructions on this in the webinar replay, which will be recorded. It is being recorded, and you'll get the link to the replay, as will people that weren't here. And I am firmly on board with helping every client make the best decision, and a knowledgeable assistant, a knowledgeable decision based on the information you provide. But here's what's going to have to change. Part D drug plans and, like I said, Medicare supplement plans. If you want a Medicare PPO plan, I'll help you. But prescription drug plans, not that there ever has been very much commission, but people that send me there or call me up on the phone on December 7th, the last day of open enrollment, I'm going to have and say, hey, can you help me enroll in a Part D plan for 2026? I'm going to have to say no. That's why I'm being proactive here, and I'm providing you the tools so that you can help me help you, and Claudia help you make the best decision. Now, I know that not all of us on this call and among my client base feel comfortable or have a working laptop or a cell phone to be able to complete a survey. As a result, what we've got, if you call the office line, and by the way, my phone now, I'll be returning phone calls in the afternoon. I won't be able to answer phone calls during the daytime, so I can get some stuff done. But if you call the office line, 214-764-6315, this is a new requirement. I don't make the rules, but every phone call, inbound and outbound, must now be recorded by agents and stored for 10 years. I'm looking at that as good news, because that means I'm going to be above ground till at least I'm 81. So, but that's a compliance requirement, and I'm all for compliance. But if you call that number, you'll have extension 1 is my number, extension 2 is Claudia's number, extension 3 is support number, extension 4 is actually a way that you can receive the survey by text, so that you'll be able to, and that'll come to your cell phone. So send it to your cell phone, and then you can copy and paste that into a web browser, or just complete it from your phone. But it is easier from a laptop or tablet. It can be done from the phone. And then you'll enter your doctor's information, first and last name, type of doctors. There's a place for comments, and you can put your prescription information in. And in the past, I've gotten a lot of messages, hey, no change. Well, I'm going to ask you anyways for this 1 year to enter all of your information, so that I can have it exactly in my quoting and enrollment system without having to type it and enter it a second or third time. And then you'll hear back by email with a calendar invite, and with an attachment with plan comparisons and recommendations for either Part D prescription drug plan, or if you want to know more about Medicare Advantage plans and you provide that information, then I can Claudia and I will do the homework and send out proposals. The first day we can do that is October 1st, and then we'll be doing this probably through the first 3 weeks in October, possibly the 4th, but I can't guarantee it. And the reason is, as much change as there is with plans for Medicare, what's happening in the Affordable Care Act world, otherwise known as healthcare.gov or a state-based exchange like in Georgia, or otherwise known as Obamacare plans, it's all being turned upside down, and nobody seems to be able to make a decision about anything. There were subsidies that were approved during the previous administration that are going away for 2026, and there's all kinds of compromises that are being talked about, but nothing has been decided upon. Either by Congress, and there are court challenges that will probably end up in the Supreme Court. But around the country, and each insurance company has to file plans with every state. And so far in Texas, the average, and averages don't mean anything, but averages are increases of 30% and as much as 71% in Texas in different areas for different people. depending upon their household income and how much of a tax credit they receive to help subsidize their health plan. The rules are anything but, the Affordable Care Act plan. First of all, the name is kind of an oxymoron, but also the rules are more complicated than those that to do your own taxes. So when the news media picks up on this and people start seeing getting their renewal notices in the mail, there's going to be an uproar. And I'm getting half a dozen calls a day that, I can't just say, hey, complete the survey for healthcare.gov and it'll go into effect. I won't know anything until November, and I won't be able to follow up with you. But if you complete the survey for Affordable Care Act plan, then I'll be able to help you there. And I bring this up now because some of you may have friends or relatives or maybe a spouse who is under 65, not eligible for Medicare. They can complete that survey. They can complete that survey, and then they'll be in line to get comparisons and recommendations once the rules are established. It'll be after November 1st. Then also there is a survey for life insurance, and if you're interested, I never really talk about it, but I'm a broker for life insurance for long-term care and short-term care, and obviously stuff like dental, vision, hearing, etc. So I'll be, if you complete that survey, I'll be following up on those after the glut of stuff to do during open enrollment. So if you're interested, you can complete that too. And Claudia's, thank you, Cloud, for putting those in the chat. I think, let me go, pardon me one second while I go to something here. Oh, okay, the new website, new.TheMedicalInsuranceExchange.com. That's going to be live. You won't have to put the new dot in there by Monday, but you will see that the links are there. The recordings will be there. So, you'll be able to click there or direct your friends and relatives and neighbors to one of those. And, I'm transparent. I'm not, just because I don't get paid on something doesn't mean that I'm not going to recommend it if it's the best thing for you and your family members or your spouse or your children or your friends or your neighbors. I believe in doing the right thing. Always have, always will. I don't run from the fire. I run to the fire. This is one of those crazy years where everything is being turned upside down, and we'll get through it. We've all lived long enough to know that things change, and then they'll change again. So don't get stressed. We'll get you through this, but I'm asking you to meet me halfway with the completion of the form yourself, or you can call 214-764-6315, extension 3, beginning next Friday. And the person that we're onboarding for answering the phones and for completing your survey, it will be able to enter your information directly into a survey form for you or your spouse or your friends, your neighbors. And I don't know what else I can do, but if you can think of something that would be helpful, please let me know. I'm going to open up questions and unmute everybody. And there's still 22 people on the phone, so I'm going to unmute people. And if you have questions that aren't specific, I'm going to, you can unmute yourself now and go ahead and ask a question. Did I unmute everybody?
Yep.
Yeah.
Hey, how you doing?
Good, appreciate it. I don't have any questions though.
I put all the information in the chat, the extensions, the numbers, and if you want to receive the survey directly to your phone number, you can call the number, then dial 1 for English or 2 for Spanish, and then dial 4, and then the survey will go directly to your text message. You will receive a text, and you can check, do the link there directly and do the survey there. Everything is recorded, and because of compliance, like Mike said. So, but everything is encrypted. All the information that you provide, it's obviously safe and encrypted. Okay. So I put in the chat all the links, the extensions, and how you can ask directly through text for the survey of Medicare. Or I have the extensions here. For Medicare is number 4, for ACA is number 5, and for life insurance is number 6.
And also, I'm going to be recording next week how you can enroll yourself at Medicare.gov for Part D drug plans. The link that you get after October, for the email that you get with plan comparisons and recommendations, will include a link to how you can enroll yourself if we're unable to just keep up in time with enrollment. But you can also enroll yourself from the email that comes out. It'll have a button to enroll in this plan. So if you have questions, it'll be pretty straightforward. But if you have questions at that point, we can answer. But now we're gearing up for a especially turbulent year, and I appreciate your hanging in there. I'm going 7 minutes. I don't want to take any more time than what I had allotted, the half hour, but I want to make sure I answer any questions.
I had a quick question, Mike.
Sure.
If you enroll in a plan, like say the 1st of next month, when does that plan become active?
For all but people just turning 65, it'll go into effect January 1st.
But for a special election?
Yeah, special election, like if you have been on an employer plan.
Correct.
And that plan is ending, you can, beginning October, right now you could enroll in a plan that would go into effect October 1st. The only thing, I won't have foresight, I can only talk about 2025 plans. You could also enroll in the best, Part D drug plan or Medicare Advantage plan. You could change those during open enrollment if you want, if there's a better plan in 2026. But I won't be able to share 2026 information until after October 1st. But you could still get coverage now for Medicare plan beginning October, but there are special forms and special processes that you have to do. So I suggest you just reach out to me, send me a reminder, and then I'll follow up with you. And I'm having office hours after this webinar until 2 p.m. to answer one-on-one questions, and you won't have to worry about sharing information on a webinar that other people listen to.
And we do encourage everyone to fill the survey right now. They're asking if they can do it right now, because that way we can put you in a list that you are the priority. We're gonna go first surveys that come. We will be making the comparisons as we receive the survey. So if you can do it right now, it's okay. We won't be able to get back to you until October 15, but we know you were the first or the second to come in, and we will attend you properly.
Yeah, well, we can actually talk to you on the 1st of October. Not that we'll be able to, there's a limit to how many people we can talk to in a day. So don't expect, you get through on October 1st. But, over the course of so many a day, we'll get to everybody, so that the first day of open enrollment, you'll know exactly what's the best option for you. And I think you're muted. Anybody have questions?
What is Part D? I'm thinking I have Part G as my supplement.
I skipped over that. Yeah. Let me spend a minute on Part D drug plans. A standalone Part D drug plan, or a Medicare Advantage plan with prescription drug benefits. Now, there was part of the Inflation Reduction Act reduced the amount that anybody on Medicare would spend for prescription drugs that are in a plan's formulary to $2,100 plus a prescription drug deductible for higher tier medications, meaning more expensive, not the cheap $4 or now $6 Walmart medications, a drug deductible of $590. So if your drug is in a plan formulary, your out-of-pocket medical expense risk beginning this year is $2,000. Next year, that out-of-pocket medical expense risk goes to $2,100. Now, for somebody on really, and I've got a lot of clients on really expensive meds, and that's a concern. Now, think about 2024. There was a catastrophic level. I mean, you could spend, 5% ad infinitum for expensive drugs, which cancer medications and similar drugs are super expensive. There's also some drugs that are being negotiated. The first of them will go into effect next year that will reduce the cost. Some insulins, not all insulins, have been included at a $35 copay. Those are the less expensive medications, less expensive insulin medications. But as a result of what the IRA also did, the Inflation Reduction Act also did, is it put some of the cost of that benefit back onto the ledger of insurance companies. So as a result, insurance companies are now responsible for more of the cost. And what they're doing, which is what you expect, they've reduced the number of prescription drug plans. They've changed the formularies. They have made a number of changes in order to mitigate costs. But there is a medication for every condition, or it may not be the medication you're on, but there will be something in a formulary that's required. It may not be on the same tier level, but there will be something that will be you will be able to use. But you also, if you're on a medication and it's not in any plan's formulary, your physician can prescribe, and it will be covered, a 1-month transition prescription. And then that gives you the time to have a conversation with your doctor about alternate meds. I can also recommend a company out of Florida, CanadianMedStore.com, that is actually a Tampa, Clearwater-based pharmacy that will 2-day ship from Canadian pharmacies, and you get it 2-day. It's totally legit. They're a great benefit for many drugs that are super expensive in the U.S. that aren't so expensive, and even generic forms that are available in Canada that aren't available here. So that's CanadianMedStore.com. So you've got some tools. You've got like GoodRx. You've got the prescription drug formulary, and then for expensive medications, you can look at Canadian MedStore. But you also want to realize that if even though you may get something less expensive from Canada or through GoodRx, if you think you're going to spend $2,100 or more in medications, you might as well get them all through your Part D drug plan. So or through your Medicare Advantage plan. And the reason being that you may end up, those, once you hit $2,100 of informally medications, that's all you spend. So, like I said, a lot of changes. The more you hear this, if you go to friends and neighbors, or social media especially, or news sources, you won't get, there's very little newsworthy stuff that's accurate these days. My approach is always to be as accurate as possible, to give good information, and to follow up and support I'm passionate about this stuff. So please feel free to reach out to me and understand my limitations and my bandwidth. And now Claudia is here to help. A receptionist will be available to help. That will be we'll be able to do certain things, but we won't share your protected health information. She is allowed to enter your information into the form, but that's all that non-licensed agent can do. So if you can think anything else that would be helpful, please let me know. Also, when you get the follow-up recording, if you have any suggestions to make this more meaningful for you, please let me know. And I'm going to shut up and answer any questions. Otherwise, thanks and enjoy the rest of your Texas fall weekend.
And thanks, Claudia. Good meeting you.
Good meeting you too, John.
Okay,
Thanks, Mike.
Thank you very much.
I'm just saying thank you. Thank you. Nice to meet you, Claudia.
Nice meeting you too, Katie.
Thanks for attending, Kathy.
Thank you.
Thanks, Mike.
One other
When's
question.
the next seminar? Are you going to have next Friday?
Yes, every Friday, for the next 3 Fridays, I'll be doing this. You can use the same link, and I'll put a calendar, put it on the website too, the recordings and how other people can sign up for this. But I wanted, you bothered to show up here. I wanted to give you a preview of this and get your feedback on this. And I promise I'll be on time next Friday at 11.
I have one question. I couldn't open up the agenda file. Is that not available quite yet? Because when I tried to pick up the file, it said no file.
Well, I have one, but I will practice that so that it's available next Friday. This is the first. I'm going to be doing this consistently for the next 3 Fridays and answer any phone calls in the order I get them until 2 p.m. today.
Great, thank you.
Thanks. See you next week.
Much.
Thank you, Mike.